Sex Ed for Kink, here we are. Thank you all for coming. This is a subject I really love talking about this. And so I do want to acknowledge that not everybody who engages in kink is engaging in it sexually, but a lot of people are. So the sex ed information will be relevant for those people. For those who are not engaging in sex when engaging in kink, there's going to be a ton of discussion about kink risk reduction as it pertains to specific kinks, be they sexual or non-sexual. So first, that's a picture of me. I am a sexual health educator. I have over 10 years of sex ed experience. I've been working with a lot of different populations. I've worked with college students. I've worked with the LGBTQ community. One of my favorite jobs was teaching sex ed in prison in upstate New York. That was really fun. But I just really like talking about sexuality with people. I do focus on pleasure and inclusivity. So I try to not be like, you know, when you were in high school and they were like, you'll get chlamydia and die. That's not my MO here. Like, safer sex, in my opinion, is part of pleasurable sex, and framing it positively is important to me. I'm also a licensed community health worker in Connecticut and a certified HIV tester. So those are my, I guess, credentials if you are interested. But I just am a person who really wants to help people have safer, more enjoyable, mutually pleasurable sex lives. So in this program, I'm going to cover 3 topics, basically. So the first, we'll review safer sex practices. A lot of you probably already know about these, but as a sex educator, I cannot stop talking about condoms, so you're going to have to hear it. Then I'm going to talk about consent, boundaries, and negotiation. And then last, risk reduction for common kinks. After that, I have a few other sort of miscellaneous topics that are relevant, so I'm going to cover those as well. But this is kind of basically how it's going to go. Okay, so this is going to be like really participatory. So you can, if I ask like an audience question, shout it out, put it in the chat. Taylor, if you could monitor the chat, that would be very helpful. Thank you. Okay, so what is safer sex? What do you all think?
Talking to your partners.
Absolutely.
Informed consent.
Mm-hmm. Yeah.
Setting boundaries and limits.
Yeah, definitely.
Asking questions, finding out whether they've been tested. Just, you know, communication. Communication,
Yes.
I think, is the
honestly,
key. Yes.
Communication is the answer to almost every question I ask. So absolutely. So safer sex is a lot of different things. So first we're going to cover basics, but I mean, it encompasses so many different things that keep us safe and happy and engaged during sexual activity. So the basics, just STI and HIV prevention. One of the risks of engaging in sex is the potential to contract STIs or HIV, but there are ways to reduce that risk. So we have barrier methods. Those include the internal and external condoms. We probably all have seen and know external condoms. Does anyone know what the internal condom is?
I'm not mistaken, that's usually the condom that goes inside of the vaginal canal.
Yes, exactly. The brand is called female condom, but I prefer to use internal condom because it can be used by any gender. But I just wanted to show you all an internal condom, just so you all know. It kind of looks like a very large condom. It is made of nitrile instead of latex, which is nice, but it is inserted into the vagina. It can also be used anally. This was recently approved by the FDA, but it's been an off-label use for quite a while. So it's just good to know that this is an alternative to the external condom. One cool thing about it is it can be inserted in advance. For that reason, sex workers often like to use the internal condom. But basically the way that it's inserted is I have this very, lifelike, exactly like real life vagina model here. But we just take the internal condom, we squeeze the ring inside of it into a figure 8. Oh, you all can't see me, can you?
No, we can see. I mean,
Oh, you can see me.
blurred
Beautiful.
background is a little, but if you hold it close, we can see.
Okay, I'll hold it right in front of my face. So we squeeze it into a figure 8. We insert it into the vagina as far as it can go. And we have the external ring sit on the outside of the vulva. When we insert a penis or toy, we just want to make sure we're holding on to the exterior ring. And that's so that when we insert, it goes inside and not to the side of the internal condom. So when we're done, we twist it, pull it out, throw it away, wash our hands. And I wanted to show that one specifically because a lot of people have heard of external condoms, but have never seen one demonstrated. So I hope that was useful. They come very lubricated. Mine is not because they're a little harder to get. So I use the same demo one over and over. Don't do that in real life. So then also dental dams. I'm sure probably some of you have heard of dental dams or maybe even used them, but they're basically just a thin sheet of latex that you take and place on the vagina or anus for vaginal oral or anal oral sex. So it just acts as a plastic barrier between the mouth and the vagina or anus. You can also use plastic wrap if you can't access like an actual dental dam because they are usually at like specialty sex toy stores and stuff. But a lot of places like sexual health clinics also give them out for free. And last, I do want to mention gloves. A lot of people don't think about the risk associated with digital sex, that is using your fingers or digits to have sex. But some STIs are contact STIs. For example, herpes or syphilis. Usually, like our hands are less likely to actually get that infection. But if we then touch our mouths or touch our genitals or something, then we can transmit it. So using gloves is a possible intervention for that. And then there's also the possibility of low-risk sexual activities. Can anyone think of an example of a sexual activity that is low risk for STIs?
Mutual masturbation, if you both take care to wash your hands before and after.
Yeah, mutual masturbation. That's pretty low risk. What else?
Dry humping.
Yeah, absolutely. So dry humping with clothes on or with just underwear on, that is much lower risk as well. I also like to mention sexting and fantasizing because those are sexual activities, but they involve, no risk of STIs. So people have sex in all different ways, and some are higher risk than others, but low risk sexual activities are a viable way to reduce STI transmission. We also have PrEP and PEP. For those who don't know, PrEP stands for pre-exposure prophylaxis, and it is a pill that you take every day to prevent HIV transmission. I know now they also have Doxy PrEP, which is for bacterial STIs, and that's doxycycline taken regularly. But pre-exposure prophylaxis for HIV is pretty commonly prescribed and widely available by prescription. PEP stands for post-exposure prophylaxis. So that is if I am exposed to HIV, for example, if I don't use a condom or my condom breaks, whatever situation it is, I can take post-exposure prophylaxis, and that's something you would typically get at the emergency room. Lube is actually a way to help prevent STIs. When we have sex, typically penetrative sex, so vaginal or anal sex, it creates little micro tears in our tissue because of the friction. And those micro tears make it easier for STIs to pass into the bloodstream. When we use lube, that reduces the number of micro tears and thus reduces the likelihood of an STI being transmitted. Now, it's certainly not as effective on its own as using like a condom, but it is technically a risk reduction method. Getting tested regularly for STIs and HIV. So first of all, if you do have an STI or HIV and you get tested, that means you can get treatment sooner. And that will, make you not sick, make you not get sick. But also, if you have an STI and get it treated, that prevents you from passing an STI or HIV on to somebody else because you know to take the precautions, get treatment, etc. So that keeps you and your partner or partners safe. And last, abstinence is a totally viable way to reduce or eliminate your risk of STIs. Sometimes in general society, we experience stigma for sexual activity, but sometimes I do find that in sex positive communities, there's some degree of shame around voluntary abstinence. And I just want to emphasize that it is okay to not have sex, and it is okay to have sex. It is fine. And if you are not willing to take on the risks that are associated with sex, abstinence is fine too. Does anyone have any questions about like basic STI and HIV prevention before I move on?
I have a quick question, actually. There's some discussion in the comments about DoxyPEP versus DoxyPrep. I know DoxyPEP is established. DoxyPrep is like newer and maybe iffy. If you could just like clarify those a little bit.
So I'm not super well versed on those. I have talked to a few doctors about their opinion on it. I would say all the doctors I talked to seemed very optimistic about DoxyPrep. DoxyPEP, you're right, has been in use longer, but yeah, that's something that I am not as knowledgeable on.
One thing I will say too, Kim, and thank you for the question, Madeline. So we actually have a provider doing our next session for Chem Sex 201, Yona Tangi. That is definitely a question I'm going to hold on to and keep because that's definitely going to come up during the next session. So if you're attending, great. If not, we can try to get that info to you if that's helpful.
Thanks, Taylor. Awesome. Anyone else?
Are you going to talk at all about how sometimes STIs can, like, you can have them, but they won't be present for a while?
That's a good point to bring up. Thank you. I can talk about that. So yeah, when you have symptoms of STIs, that's obviously a good reason to go get tested. Symptoms might include pain when urinating, discharge from the vagina or penis that is unusual in some way, rashes, certain rashes can indicate that you have an STI, but also especially for people assigned female at birth, you may not experience symptoms. And that's why regular STI and HIV testing is important, because the only way to really know for sure if you have an STI is to get tested. So the CDC recommends getting tested every 6 to 12 months for sexually active adults, but that may not be frequently enough if you are a higher risk individual. Now, higher risk doesn't mean like you're doing something bad. It just means that you are in a situation where you're more likely to get an STI. Some examples are if you live in a city that has high rates of STIs, having multiple partners means more chances of exposure. Having sex without a condom regularly will put you at higher risk. So then you might want to think about getting tested more frequently, every 3 or 4 months, maybe. Thank you for that question.
Thank you. I just know that sometimes things can stay dormant.
Yeah.
Like herpes 1, for example, right? A lot of times it shows up as a cold sore, but it can be transferred to the genitals, and sometimes it just pops up, and you don't know necessarily where exactly it came from if you've been sexually active, because especially with herpes, it's hard to test for unless there's an active
Right.
rash.
Yeah, HSV testing is no longer recommended as routine by the CDC because if you don't have an active sore, then the test is not super accurate. Some estimates are up to 50% false positives, which obviously is like a coin toss. But if you do have an active sore, then they are able to make a diagnosis on that. Great. Anyone else?
Yeah, just one little other point. You did touch on it, but I think it's so important. It's the U equals U when it comes to HIV.
Yes,
Yeah,
yes.
you did sort of touch on it, but I just wanted to make that so very clear that if you are taking your meds, on a regular basis and getting tested, you cannot transmit HIV, no matter what you do. Trust me, I have tried. You can't. Okay? Yeah.
Yes, yeah. Thank you so much for bringing that up too. Yeah. If you have an undetectable viral load of HIV from taking medication, then you cannot transmit HIV. Yeah.
I see a hand from Candy.
Okay.
Heyo, I'm Candy. I'm in Baltimore. Can you say a little bit about spit versus lube?
Oh yes, spit is not lube.
Thank you.
There are some lubes that can be reactivated by spit. It is technically somewhat higher risk because if you have, oral herpes or something like that, that could transfer an STI similarly to oral sex. But yes, please use lube, not spit.
Thanks. I just wanted to hear somebody who's like a professional say it out loud so that I can continue to yell it at people. Thanks.
Yes, yell it at everyone. Get on top of a building and yell, spit is not lube. All right, so let's move on to pregnancy prevention. That's not going to be relevant for everybody, but many folks are in couplings that could result in pregnancy. And a lot of times queer folks in particular are overlooked in this because not everybody, but it is assumed, unfortunately, that people who are queer are only having sex with people with the same genitals as them, which is not necessarily true. So there's two main categories of birth control. We have hormonal and non-hormonal. Does anyone have any examples of hormonal birth control that they can think of?
The arm implant.
The arm implant, yeah.
And progesterone and estrogen.
Like the pill?
Yeah, I mean, there's the shot, the pill.
Oh, okay. I hear what you're saying. Like just generally, yeah. Typically it's a combination of progesterone and estrogen or sometimes just progesterone. Thank you.
I was wondering if you're going to talk about the added risk of cancer because of using synthetic hormones as birth control.
So that's so from the studies I'm aware of, that is debatable depending on the cancer that you're talking about. So for example, it is associated with a slightly elevated risk of breast cancer, but it's also associated with a lowered risk of certain reproductive tract cancers. So it's definitely a risk-benefit analysis that you would have to discuss with a provider. But yeah, no, there's definitely risks and benefits. Another risk that is associated with hormonal birth control is an elevated risk of blood clots, especially for people who smoke cigarettes. So that's also something to be aware of. So, but yeah, as I heard, I can't remember who said it, but like the pill, the shot, the patch, we have the arm implant, we have the hormonal IUD. Those all work by suppressing ovulation primarily, and they are available by prescription. We also have types of non-hormonal birth control. We talked about barrier methods. Condoms and internal condoms prevent STIs, but they also prevent pregnancy. They do double duty. That's fun. We have the copper IUD, which the copper creates an environment that's inhospitable to sperm. It kind of like paralyzes them so they can't go where they're trying to go. And then we also have symptothermal methods. So this is something that requires a bit of training and really good consistency. But for folks with regular menstrual cycles, it is possible to track your bodily stats to predict when you're going to ovulate. So some people do choose to use that as well. There's also methods like withdrawal, that's pulling out. It is definitely lower efficacy than, for example, hormonal birth control, but it works better than, ejaculating inside of somebody, for example. Can anyone think of any other birth control methods that I haven't covered? There's a ton, but.
I put
Permanent
in the
birth
chat.
control methods.
Uh-oh, we just had two people talk at once.
I put in the chat about diaphragms and foam or gel.
Of course, yeah. So those aren't as common these days, but they do exist. So diaphragms are basically used, they're inserted into the vagina to block sperm from getting into the cervix. Gels, I assume you mean spermicide gels. Those are typically not recommended anymore because they elevate the risk of HIV transmission. If you do use them, they should be used in combination with another method like a diaphragm.
I think that was the other thing I was thinking about too, is that the one thing I tell my kid is 2 forms of birth control at all times.
Yes, because one can fail. Absolutely. I mean, people get pregnant on the pill, people get pregnant using condoms. It certainly reduces the chance, but if you want to double up, that'll give you extra security.
Kim, quick question.
Yeah.
And again, if we don't get to all the questions in the chat, I'm keeping track, and I love this engagement, by the way. But someone is asking, is there anything specific you might know about bone density loss with Depo-Provera, the birth control injection?
So I don't know like everything about it, but I am aware of it. So Depo-Provera is associated with bone density loss. So it is not recommended to be used for more than 2 years. It is also important to note that there is a class action lawsuit right now against Depo-Provera. I don't think that one is specifically bone density loss related. It's something else, but definitely make sure that you read up on any type of birth control you're going to use before using it, but on Depo-Provera as well. All right. So then again, low risk sexual activities like we discussed will also prevent pregnancy. You are not going to get pregnant from mutual masturbation. I mean, unless the sperm goes really nuts and lands very opportunistically. We have sterilization. So that is a tubal ligation for people with ovaries, or a vasectomy for people with testicles. And that permanently stops you from being fertile. So that is only if you are a person who does not want to have kids or does not want to have more kids. Technically, vasectomies can be reversible, but it's about 70% reversible and it costs a lot of money. So you really should only do that if you are very sure you don't want to have any more kids. Next, we have emergency contraception. That is a pill that you take after you have been at risk of pregnancy. So again, kind of like with PEP, if the condom broke or you didn't use one or you forgot your birth control pill, whatever, you can go get that over the counter at drugstores. There's a few different kinds, but you have to be aware of the weight limit on some of them, or on all of them, I guess. There's 3 different pills. One of them, the weight limit's 195, and one of them, the weight limit is 165. If you do weigh more than that and need emergency contraception, you should talk to your doctor. Sometimes doctors will tell you just to take 2 of them or something like that. And then the copper IUD can also be used as emergency contraception for people of any weight. And then, of course, we have abortion. That obviously is not pregnancy prevention, but it does prevent you from staying pregnant if you don't want to be. And in Connecticut, where I live, it is currently legal. For folks who live in states where abortion is not legal, there are funds that can help you go get an abortion in another state. There was recently a court case, I think in Alabama, that they cannot legally prosecute somebody who assists you in getting an abortion in another state. So that is good news for folks who live in states where abortion is not accessible. Does anyone have any questions there?
Kim, really quickly, someone did ask to specify what those 3 pills you mentioned were.
Oh, yes, yeah. So Plan B and Julie are for people up to 165 pounds, and Ella can be used up to 195 pounds. All right. All right, sex ed trivia time. Let me share a different screen now. Start. All right, so question number 1. Oh, no, first we're telling the title. Okay. Quiz. What's an example of a barrier method of birth control? Pick the one that you think is correct. All right, and the answer is syphilis. Rash on the hands and feet are a very classic symptom of syphilis. Next. Nice job. True or false? Herpes can lead to cervical cancer. All right, so actually that is false. What you may have been thinking of is HPV, human papillomavirus, and that is associated with cancer. And the HPV vaccine, Gardasil, prevents a lot of the strains that lead to cancer. So good job. Next, how often should a sexually active adult get tested for STIs, according to the CDC? Every 6 to 12 months, but like I said earlier, that depends on your risk level. So that is something you will have to evaluate, whether you are at high risk and thus should get tested more often. All right, nice job. Next one. Which of these is the least effective method of birth control of the choices? All right, so statistically, spermicide by itself is actually the least effective of those. And that's why it's typically not recommended on its own. I saw a lot of you said pulling out. That is definitely a lower efficacy method as well. So that it makes sense that you would say that. All right. Next, which of these is most effective at preventing HIV? The answer is PrEP. Yes, so PrEP is over 99% effective in preventing HIV. Well, statistically speaking, it is very effective for sexual transmission. If we're talking transmission through needle sharing, it is a bit less effective, but it is still pretty useful for that. After that, we have condoms as the next most effective. Using lube is a little bit helpful. Birth control pills do not prevent HIV. All right. What does informed mean in relation to sexual consent? You've discussed what sexual activities you'll do. Exactly. You know exactly what you're going to do. You know the risks. You know the benefits. And yeah, the other ones are probably important, but not part of informed consent. All right. Here we go. Which of these is a viral STI? All right, herpes is a viral STI. Yes, the rest of them. So syphilis and gonorrhea are bacterial and trichomoniasis is parasitic. All right, we're getting there. What does a Pap test screen for? Cervical cancer. Great job. Yes, that is, Pap test should be gotten typically every few years, but your OBGYN will give you recommendations, and it is a very effective way of screening for cervical cancer. Next. Nice. And we've got our last one. Using lube reduces your risk of STIs. That one's a freebie because we talked about it. Yep, the answer is true. It does somewhat reduce your risk of STIs, although it is not as effective as a lot of other methods like condoms.
And one thing that came up, a couple people asked while you're switching over. What about double dosing, Julie? So people asked about that if because they thought that you're not typically supposed to double dose, but what's kind of the advice or best practice for that?
So the best practice there would be to ask a provider because it's probably going to be different for different people. But I do know that some providers do tell people to double dose. Awesome. Okay. So consent, I'm going to assume that we all know the basics of consent. We have to be fully aware of what we're engaging in. We have to be like in a headspace that we can make good consent choices, no coercion, etc. But I want us to think right now about how different relationships can impact consent. So for example, somebody new versus having a longtime partner. When you are having sex with somebody new, it might be a lot more verbal communication, for example. You don't know what their boundaries are, what their preferences are, what they like, what they don't like. So you're going to have to ask a lot more questions. Whereas with a longtime partner, you've learned some of their boundaries. You've kind of gotten a feel for what preferences everyone has. And that's not to say you don't have to obtain consent with a longtime partner, but it can look a little bit different the way that you do it. There's also the issue of power dynamics to think about. So what's an example of a relationship in which one partner may have a higher level of power than another?
One partner may make more income.
Yeah, definitely. One partner makes more income.
I would
In
say
a lot of communities, it's just women and men.
Yeah,
Basically.
gender.
Yep.
Thank you. I heard another person.
I was going to say the same thing. Thank you.
You're
Yeah.
welcome.
Absolutely.
Great minds think
Honestly, all kinds of marginalized identities, honestly. So a couple who is different races may have a power dynamic. A couple where one person passes a cisgender and the other is obviously trans may have a power dynamic. There's also power dynamics that can affect a relationship to a point where it's maybe not safe. For example, a boss and a supervisee, that might be an ethical issue. There's also power dynamics in sex work. So the sex worker is, trying to make money or make a living or whatever it is they need. And so they may not feel as much like they can say no to a client. So that can also affect a power dynamic. Can anyone think of any other examples of power dynamics?
In this context, are you taking into consideration pre-negotiated power dynamics, or is this just non-negotiated, non-consensual power dynamics that just so happen to occur in day-to-day life?
The non-negotiated ones, yeah.
Okay, good to know. I just wanted to clarify. Thank you.
Yeah, thank you.
An example that I was thinking of was if you're like having public play in a dungeon space and you're playing with the person who like stewards that dungeon space.
Oh, absolutely. Yeah. So like the owner or employee or something of a dungeon space, playing with them may make you feel like you're less able to say no.
Religion. I feel like religion is a big one for a lot of people.
Oh, definitely. Yeah. Your religious beliefs can definitely affect a power dynamic in a relationship.
A big difference when it comes to level of experience in certain sexual/kink practices as well could impact that.
Yeah. Thank you. Okay, so let's move on to boundaries. So who wants to tell me what are boundaries?
So boundaries are pretty much like the yeses and no of engaging with another person. It could be sexual or it could just be like in a relationship or, your encounters with someone else.
Yeah, thank you for mentioning that. It's just an everyday thing. So for example, like you may have boundaries with Like, do your friends have to ask you before they come over? Do you have your special snack that your partner is not allowed to touch without asking you? Those are examples of boundaries that are non-sexual. But we also have sexual boundaries. And we have to figure out what those are, because it can be a process to figure that out. We want to start out just by talking about likes and dislikes. Think about what you like, think about what you don't like. That can be the starting point for your boundaries. We also want to think about hard and soft no's. So a hard no would be something that you are never interested in doing, ever, under any circumstance. I see a hand being raised. Avery?
Yeah, about the soft and hard boundaries, and I was just about to put something in the chat about the stoplight like analogy. I've heard that can be really helpful for people, like, you know, absolutely hard no, you know, something I refuse to do is a red light. Something I'm open to but not 100% on board with is like a yellow light, and then green light's obviously, you know, what's good.
Yeah, awesome. Thank you. So I will talk about that a little bit in safe words. But yeah, no, that's a really good way of signaling your hard and soft no's. So a soft no would be something that maybe you are a little apprehensive about, but open to trying, or something that you're interested in certain situations or contexts, but not others. So for example, say that you are with a new partner. And if you don't know a person well, maybe you don't like to perform oral sex. In situations where you like a person and know a person and have been with them for a while, maybe you do like performing oral sex. So it would be a soft no because it's dependent on the situation. Learning boundaries is an ongoing process too. It's about trial and error. You may be interested in something like either fantasizing about it or you read about it and want to try it, and then you try it. Turns out you don't like it. You found a boundary. So it's important to trust your gut, but also be open to new things. It's okay to say even halfway through, like, actually, I don't like this, let's stop. But if you don't try new things, then you might be missing out on something. On the other hand, that doesn't mean you should be trying things you're seriously uncomfortable with. It is okay to say no outright. And communication is what's most important for boundaries. If you don't tell your partner what your boundaries are, they're not going to know them. And if you don't ask your partner what their boundaries are, you're doing both of you a disservice. So safe words, we just mentioned. Safe words are words when we say them, it signals that we need to stop everything. All sexual activity. So safe words, commonly people use the red, yellow, green system. So red, yellow, green can mean different things to different people though. So sometimes I hear red is stop everything, yellow is stop this specific activity and change activities, and green is keep going. In other cases, I've heard red is typically stop everything. Yellow is I need a check-in, and green is go, like keep going. So even when you're using a system that a lot of people are aware of, like red, yellow, green, you still have to talk about what those things mean to you. So that if you say yellow, the person you are interacting with knows what it means to you. You can also have safe words that are just a word that means stop that's unrelated to sex. Things like, you know, pineapple or aardvark or something like that, that you typically wouldn't hear during sex. Or you can have safe actions. Now, this is especially important when a partner is unable to talk for some reason, like, for example, if they're gagged, or if they're a person who is nonverbal. An action could be as simple as tapping on the person's shoulder. It can be holding an object that makes noise and dropping it as a no. Sometimes people will have a baking sheet underneath, so it makes extra noise. I've also heard of using a bouncy ball that lights up if you're doing something in the dark. There's a lot of different ways that we can have safe actions. It's also, of course, important to respect other people's boundaries. It's fine to ask somebody if they're interested in doing something, But if they say they're not, it is not okay to badger or pressure them. Like saying, oh, come on, or like, you do it if you loved me. Those are not, that is not okay. You also want to make sure you're checking in regularly, even if this is somebody that you've been with for a while, saying, hey, is this okay? Or how are you doing over there? Or, I mean, you could say it's sexier too, like, oh, does that feel good? You like that? Those are all different ways you can check in. We also want to talk after sex about what we liked and disliked, because maybe we tried something new and we want to see if you liked it at all, if there's something you'd want to do different next time, if there's something that made you uncomfortable, if there's something you want to try again. Now, unfortunately, it is not possible to communicate everything 100% clearly at all times, because language is fallible. And also, sometimes a person doesn't know their own boundary until they've experienced that thing. So it is possible to inadvertently violate a boundary. Now, what should you do if you violate a boundary? Any thoughts?
Check in, apologize, figure out what you did wrong, make a plan to not repeat the action, and figure out how to just communicate the entire process around it so that when people are uncomfortable and they start getting uncomfortable at first, it's communicated early on and can be navigated a little bit more safely.
Perfect. You just did my job for me. Awesome. Yeah, so apologizing, very important. Asking what they need, definitely. Find out, do they need time alone? Do they want to talk? Do they want aftercare? I mean, it could just be like, hey, I didn't like that. Don't do it again. Or they could be really upset. It really depends on the person and the action. Then you want to discuss either right away or later exactly what the boundary was and make a plan to avoid it happening in the future. And respect their wishes. It may unfortunately be something like not seeing you anymore, or it may just be like, hey, can I have a hug? But since they were the person who experienced the boundary violation, they are the person who should be prioritized. I see a hand from Sarah.
So I'm a prevention program manager at a sexual assault resource center, and I spend a lot of time talking to people about consent and boundaries. We also like to talk about what happens if you cross your own boundary with yourself. So like if I, for example, have a boundary, like I do not have anal sex, say that's one of my boundaries. And I decide mid-dream, like I'm digging this, let's do it. I've crossed my own boundary. And then I'm going to check in with my partner and be like, do I want to do that again? Do I want to change my boundary? Because we describe it as rules that you make for yourself, not for other people. But if those are your people, they're going to respect that rule that you made for yourself. But we also have to talk about crossing our own boundaries and how we feel when we do that with ourselves.
Thank you so much for mentioning that. Yeah, that's a really great point.
If I may add on to that as well, I think it's also important to think of, a lot of people might end up having a boundary violated, and it may be a boundary that they were not initially aware of that you accidentally violate. So it's also important to keep yourself in mind in that situation. Recognize that the intention was never to violate a boundary that was not explicitly verbalized originally. Be able to make amends with the person, have that conversation while also giving yourself some internal aftercare of, hey, you didn't actually mean to do that. This person is upset. It's okay. Hold space for them, but also recognize that you're not a bad person for violating something that was unspoken and unknown originally.
Absolutely. Yeah, it definitely does not necessarily make you a bad person. So thank you for bringing that up. All right. So now we get to talk about kink. What is kink? What do y'all think kink is?
I think kink is one of those self-defined things. Like kink is whatever you want it to be.
Yeah, it's very subjective. You're right.
I would say it's an expanded term to kind of encompass a lot of activities that would also not fit under the BDSM umbrella as a whole. That would include mental play, things like erotic hypnosis and the like. So it's an extension, it's an expanded explanation onto the more limited BDSM terminology.
Mm-hmm. Yes, thank you. That's good.
I was gonna say, just generally speaking, the term straight, meaning cisgender, male, female, what people used to call normal. So kink just meant anything that wasn't straight, anything that wasn't, that's where the term kind of came from. If you're kinky, you were just not completely straight.
Mhm. Yeah, so kink can mean a lot of things, and it also varies by culture, time period. Like you said, I mean, at one time, not being straight was kinky. Depending on your culture, religion, etc., different things may be kinky. But the clinical definition of kink is non-conventional sexual practices. And of course, that again is kind of subjective. Like for example, is doggy style kinky? I don't know. It depends on who you're talking to. Is hair pulling kinky? Depends on who you're talking to. So it is about up to personal interpretation. So kink can impact consent. And a big part of that is because when you're engaging in things that are less common, you have less of a framework for like what to do, what is safe. You are more likely to lack knowledge. And that's not to say nobody knows about kink, but it's something you're not taught in school for sure. There also are a lot of times behaviors that in other scenarios could be abuse. Like BDSM can involve tying people up, hitting them, and in a normal situation, like outside of sex, if somebody walked up to me on the street and hit me with a flogger, I'd be really pissed. But if it was something that you consent to and like, then that is completely different. It's also a good idea to be aware of the laws in your state. So I live very close to Massachusetts, and in Massachusetts, you cannot consent to battery, which means that BDSM is technically illegal in Massachusetts. Of course, that's fairly difficult to enforce, but it's definitely something to be aware of, that there could potentially be legal consequences. So I'm going to talk about safety for some of the most common kinks. These kinks, I chose these specific kinks because research shows that the most people who engage in kink engage in these ones. But there are a huge number of kinks out there, and unfortunately I can't cover every single one, but I'm going to do my best. So bondage and rope is a very, very common kink. There's rope studios everywhere. There's actually one like 15 minutes from my house in Connecticut. There's people like to, try it out in their bedrooms on their own. People will like watch porn with bondage. But it does carry some risks. A lot of people go into rope thinking it's very easy, but depending on what you're doing, it can come with risk. So for example, circulation issues, nerve, joint, or tissue damage. If we are tying improperly, those are all potential issues. So there are some ways to mitigate those. First, learning from somebody experienced is a really good idea. If you have a studio or a dungeon in your area, you might want to try to learn from somebody there. If you live in an area where that's not accessible, there are a lot of resources. I like to recommend 2 Naughty Boys on YouTube. They're very fun. I think they might have a podcast too. There are also lower risk bondage options. So something relatively risky would be a suspension rope scene where somebody's feet are not touching the ground. On the other hand, a lower risk scenario would be maybe tying somebody's hand to your bed with a scarf. Chances are that's not going to harm somebody. At the same time, that does still carry some degree of risk. Something you want to have on hand if you're engaging in bondage or rope is trauma shears. Now, not just regular scissors, not your sewing scissors, not your paper scissors. Trauma shears are available on Amazon for really cheap, and they are used in medical scenarios like where we need to cut someone's jacket off because we're an EMT. And again, or not again, I didn't say this yet, but don't leave a tied person alone. That is very risky. What if they fall over? What if they lose circulation? What if they need to go to the bathroom? If the person, so I talked to somebody who told me a scenario where their partner wanted to be tied up and left, but that's not a safe scenario. So what they did was they tied up their partner and went into the other room where they could keep an eye on them, where the partner couldn't see them. So it gave the impression of being left alone, but they were not in any immediate danger. So there are ways to enact things we're interested in that would otherwise be risky in less risky ways. All right, so voyeurism. So first I want to ask, what is a form of voyeurism that most people do at some point?
Watching
Porn.
porn.
Watching
pornography.
Porn, yes. So voyeurism
Thank God for porn.
Yeah, so
I'm
voyeurism
just gonna
is...
toss that out there, Josh. Okay. Yeah.
It's watching people have sex who are not aware you're watching them. So porn is specifically made for that purpose. The actors make this video, they publish it, they don't know you're watching it, but they gave their consent for you to watch it by creating this content. In a non-porn scenario, there would be inherent problems with regards to consent for voyeurism. Watching somebody without them knowing you're watching is like a sex crime. So we can't be doing that. But we can think of ways to engage in a scenario that feels like voyeurism without violating consent. So, for example, say I want to watch somebody masturbate without them seeing me. I could say to my partner, hey, so could you masturbate in front of this window at 8 p.m. and I will sneak up where you can't see me and watch? We have a voyeurism scenario where we feel like we're engaging in that act, but we're not violating somebody's consent. All right, so next, multiple partners. Now, some people will argue that multiple partners is not a kink, but like we said, it's really subjective. So some people may engage with multiple partners at once and be like, oh, I'm being really kinky. And some people, this may just be run of the mill. But it's still important to think about risk and risk mitigation. So the most important thing with multiple partners, communication is extra important. It's not just one extra line of communication. It is communication between each party, both about each other and about the additional party. So if I'm with person one and person two, I need to know how myself and one feel about each other and how myself and two feel about each other. And one and two need to know how they feel about each other. But then we also need to know all of those interrelationships between the other two people, because we need to know how everybody is feeling emotionally and know that everybody's feeling safe, knows what's going to happen, is in agreement with how things are going to go. It can get really complex. So we need to make sure we are doing an extra amount of communication. We want to discuss beforehand. We want to check in regularly. Another thing to consider is that when we have more people involved with us sexually, that does create a higher risk of STI exposure. Just, the more people you come into contact with, the more likely it is that you'll encounter a person with an STI. So we want to talk about safer sex. And we always want to talk about safer sex, but the more people that are involved, the more important it gets. We might want to talk about who's been tested, when, whether they have other partners. A way to lower the risk there too is to consider a closed group. So like a word that people will use maybe is like throuple or a polycule. I've heard polycule. And a closed group where everybody's been tested and is not having sex outside that group is going to be lower risk than a group of people who are also having sex with other people. All right. So I want to briefly touch on Chem Sex. I know that the next presentation in early May is going to be with Yona Tangi, and they're going to be talking a bunch about Chem Sex. I've seen them talk. They know what they're talking about. So go to that. but I want to just briefly touch on it here. Again, this is something that not everybody considers a kink, but it falls under the category of non-conventional sex practices. So I just want to make sure it's touched on. So Chem Sex complicates consent because drugs alter your ability to make judgments. If someone's incapacitated, they cannot consent. Ways you might know that somebody's incapacitated are confusion. They can't walk unassisted. They can't speak coherently. And if you're not sure, just do not have sex with them. It's better to err on the side of caution and keep somebody safe than to accidentally violate consent. We also want to know that drug use is always risky. When you put a substance in your body, I mean, even if it's a prescribed substance, we don't necessarily know how it's going to interact with our body. And when it's an unregulated drug, we don't even necessarily know what's in it. Some of the most common drugs that we use for chem sex are poppers, meth, which sometimes people call Tina, MDMA, people might call that Molly, and GHB, which people might call Gina or G. Now, there's all kinds of specific harm reduction protocols for each of these, which I'm sure that Yona will talk about in a couple weeks. But generally for drugs, if you are choosing to use drugs, which legal purposes do not condone, etc., but some people are going to choose to use drugs, and they should know these safety things. Starting slow is important. So if you don't know what your tolerance is or how it's going to affect you, just take a little first and wait. Testing your drugs, both with fentanyl test strips, which most harm reduction centers offer for free, or with one of those reagent kits, which you can get at Dance Safe or WIM laboratories. That'll tell you the ingredients of a lot of different kinds of drugs. So definitely look into those. Don't use alone, especially with drugs that carry a risk of overdose, but just generally better to not use alone in case something happens and there's an emergency. And check for drug interactions. So a lot of us probably take prescription drugs for various purposes, right? And those can interact with recreational drugs. So make sure you do your research on that as well. Okay.
Can I add something just before you go on, if you don't mind?
Please do.
So I know that traditionally these are the drugs that have always been linked to chem sex. I just want to point out that for many communities, these are not the drugs that are used. For example, in the African, Caribbean, and Black community, I don't know what you call it in North America, but I come from Canada, and that's how we differentiate. The drugs that are usually used are alcohol and weed. So I just want people to understand that it's the same chem sex. You're using drugs to heighten the sexual experience, but might not traditionally be the same drugs that we use. So it's always good to know what people are using when they speak about chem sex. Thank you.
Yeah, thank you for pointing that out. And actually, I appreciate you pointing out alcohol in particular. A lot of people don't think of alcohol as a chem sex drug because it's legal and regularly used, but it absolutely is used for that, as is weed. Yeah, and all kinds of drugs. So thank you. Okay, so a lot of people have questions about choking. Choking is becoming a lot more common. And as we've seen porn become more available, rough sex practices have also become more common in the United States. That's not to say that we shouldn't be having rough sex or anything like that, but we should be making sure to be as safe as possible. So choking has a pretty high risk of injury or death. I cannot say like don't go around saying Kim Adamski told me I can do choking. It's very risky. But again, people are going to engage in it, and it's good to know some means of risk reduction. So first, you might want to just think of a way to simulate the idea of choking rather than actually choking somebody. Using a collar, for example, could create the sensation of having something around your neck with lesser danger. Lightly putting your hand on someone's throat, just like resting it there rather than, constricting their breathing. Again, that can kind of feel like the idea of choking. Using a scarf around the neck just to kind of create that snug feeling, kind of like a choker or collar. If you are choosing to engage in actual choking, like constricting airflow. You want to make sure that you are applying the pressure to the sides of the throat, not the front of the throat, because that reduces the risk of choking, like constriction, sorry, brain fart. And also the person that is being choked should be able to verbally respond. If they can't, that means that they're being choked too tight and they're in danger. So again, choking is a pretty contentious one, but people are doing it, and we need to know how to do it in a less risky way if we're going to do that. Impact play, another really common one, also commonly known as hitting. We can use all different kinds of implements for that. We can buy fancy floggers or paddles, or we can just go get a wooden spoon out of the kitchen, or we could just use our hand, that's free. But there are some ways to make that safer because there are risks associated with it. For example, if you hit certain spots on the body, you can injure the bone. You can cause tissue injury. If you're hitting too hard, you can break skin. So we want to know how to reduce those risks as well. So first, we want to be good at aiming. If we are trying to hit a spot, we want to make sure that we get that spot. So you could practice your aim on a pillow beforehand. You could practice it on a chair, something like that, and try to make sure you get the same spot that you're looking at with your implement. We also want to start lightly and work our way up. So one method I recommend is you start with a light hit and you ask the person to rate it from a 1 to a 10. You also want to have them tell you what number they'd like it to be. So then you hit them again, have them calibrate it. So say with the first hit, I say that was a 2 and I'd like to be at a 5. So then the person will hit me a little harder. I'll say, okay, that's a 4. I want that to be at a 5. So then they hit me a little harder and I'm like, actually, no, that's a 7. Walk it back. And we want to calibrate it until we get the exact pressure that the recipient wants. Continue to check in if you are if they look like they're maybe a little anguished, be like, what number are we at now, just to check. But I think that that's a really good way of calibrating. You also want to know what is and isn't safe to hit on the body, and I will show you that in another slide. And then have first aid available. So you may want an ice pack, you may want to have like Band-Aids, antibacterial, antimicrobial, whatever you might need to fix any, if you're doing impact play, there's a good chance of getting bruising and stuff. So whatever supplies you're going to need for that. And then make sure that the person's hydrated as well. Again, like I mentioned earlier, know the laws and potential consequences, because in some places you cannot consent to battery, thus this would technically be illegal. And these are the spots that are safe and not safe to hit. So the places highlighted in green are safe. Those are usually the areas that are very muscular or fatty, and can take a fair bit of pressure. The yellow areas are lower risk, but be cautious. So the upper arms, for example, be extra careful with them, give them care. Orange is high risk. There's important bones, nerves, organs in those areas. A light slap maybe is okay, but anything more than that is dangerous. The red areas, which are the ankles, knees, neck, and elbows, just don't hit them. It's not safe. Does anyone have any questions about the kinks I just covered? All right, so I want to give opportunity to talk about other kinks. I did get a question about blood play specifically, so I do want to cover that. What are some of the risks that you could think of blood play?
Higher risk for HIV, general contamination overall. In that case, bacterial infections, etc. Just higher risk there.
Absolutely.
Han, I see your hand.
This is something like I have something to say about something else. So after they're done talking about, can I say it?
Yes.
Okay.
So bloodborne illness is definitely an important one to think of. If we are coming into contact with somebody else's blood, we could be at risk for HIV or Hep C. There's also a risk of infection, depending on what implement you're using to break the skin. And in a very serious situation, there is potential for heavy bleeding. So those are some of the major risks of blood play, but they can be mitigated. So the bloodborne illness one, there's a lot of different bloodborne illnesses, but HIV and HCV are big ones of concern. So getting tested for those and knowing your status on those. And also using gloves or PPE. We also want to make sure that we clean the skin before cutting or puncturing it. So like a doctor would if they're giving you an IV, use like an alcohol wipe. We also want to try to use sterile single-use instruments. If we can't use single-use, we still want to make sure they're sterile. So putting them in boiling water for 15 minutes or something like that, if possible. And again, having a first aid kit on hand with things like alcohol wipes, Band-Aids, antimicrobial ointment. And in an emergency, be prepared to call 911. If somebody has like a major injury, you don't want to try to deal with that on your own. You should have professionals come in and do that. Han, what was your thing?
So this is not necessarily kink related, but it is related to safer sex. So there's a pretty large COVID cautious community that is still, it's like disabled folks, chronically ill folks, or folks who just are trying to take some precautions. And within the community, they talk about the Swiss cheese method that can be used for like general day-to-day stuff to keep yourself safer from COVID or other airborne illnesses. So like wearing a mask, regularly testing, getting vaccinated, and this can be translated into safer sex practices. So like you can wear a mask or a respirator, which is a KN95 or better during sex. You can do safer air practices, so have air ventilation or airflow with like a cracked window, or use an air purifier or multiple air purifiers. And then you could also test along with like STI testing before having sex with another partner or partners. You can do a rapid COVID test and have 2 negatives within 48 hours, or you can use a PCR test that has higher, it's more effective, or has a higher, it's like right more of the time. So just mentioning that because a lot of disabled and chronically ill folks are still trying to protect themselves from COVID, and it can be translated into safer sex practices. So yeah, that's it.
Thank you so much for adding that in. Yeah. And I've noticed, at least in my area, a lot of the kink communities do require masks and or vaccinations and or testing prior to attending events. So that's definitely something I see more in the kink community than other groups. So yay for them. Any other kinks people want to talk about?
This is just a generalized statement on my part. And for me, I think so much of what we call kink came out of the gay community in so many ways. And now that it's being normalized, for lack of a better word, by the straight communities, I think there's a wonderful pushback, and people are actually experiencing more good sex than they ever had before, especially straight people. I feel really sad for straight people. You have no idea. No, I really do. I mean, every day I thank God that I did not, I'm not. And, and every day I kick myself and say, well done, Colin. But so much of it too also relates to, and I think somebody mentioned it, the religious aspect of it, where from the Middle Ages, sex was just purely for procreation. Anything else was considered immoral, ungodly, and kinky. So I think it's also important that we remember that so much of this has been used to oppress people when it comes to sexual wellness and sexual enjoyment. So I just wanted to toss that.
Yeah, thank you. Absolutely.
And
Um,
yay, straight people, about time to learn.
Yeah, I mean, I think that kink in general encourages people to experiment with sexuality in general and find new things they like. So you make a really good point. All right, so, right. There we go. Okay, so subspace is something I want to talk about just because there are certain risks associated with it. Subspace is a feeling of euphoria that a sub or submissive, the person receiving impact play or what have you, can get. And it's kind of like, some people describe it as like floaty or dissociating with their bodies, which is associated with the adrenaline that impact play can create. And it can alter their cognitive function. And this is why communication and planning before engaging in kink is so important. Because, I mean, even if you're not in subspace, once you're in the middle of sex, you may not be quite in a great decision-making mode. If you are the dominant or the person delivering the impact play, it is your job to monitor the submissive for signs of subspace and signs of distress. If a person is in subspace, they may not be able to communicate normally or at all. And it's up to the dom to make the call to stop if they feel that somebody's safety is at risk. If the sub has experienced subspace before, it might also be a good idea to talk about the signs that show they're in subspace with the dom, so the dom is fully aware. Aftercare, very important. When we're engaging in particularly play that can cause physical pain or just subspace, or may bring up intense feelings, we need to engage in aftercare. And actually, I see two hands, so I want to get to those first. Aiden has a hand up.
Yeah, if I may, I did want to mention as well, there's the opposite, the other end of the spectrum when it comes to subspace. I do want to mention that dom space does also impact certain, I wouldn't say necessarily decision-making activities, but the general mind space the person is in, which is why it's definitely more important to focus on the communication pre-scene, pre-kink play specifically, because the heightened level of endorphins, the general feeling that happens within dom space can lead to a likelihood towards more impulsivity, towards overlooking certain signs, as much as the conscious effort is there to keep everything in mind. So definitely making it a priority to focus on the communication before and making the safe word signs, whether traffic light system or otherwise, very clear throughout the play, rather than leaving it to just, we need to monitor little signs of subspace / dom space, and I guess keeping it just to that.
Yeah, thank you so much for that input. Yeah, dom space is absolutely also a thing and can alter your cognitive function, your impulse control, and that again is why it's important to talk in advance. So aftercare is also really important, and it's not, people think of it as aftercare just for the submissive or bottom, but it's also important for the top. Sometimes people who are tops experience top drop, which is when they're coming down from all those endorphins. In a dom sub situation, they may need reassurance, for example, that they're not actually like a dominating person who hits people, even though they know it was all consensual. It can cause feelings of all kinds. And subs may need aftercare, like a blanket, snuggling, reassurance. I mean, everybody's aftercare is different. And this is also something we want to discuss in advance. So we should talk beforehand, like, okay, after you engage in a scene, do you want to have a snack on hand? Do you want me to lay out this blanket for you? Should we have, like, do you want a back rub? Something like that. And have all the supplies ready to go in advance. I know somebody whose partner's aftercare is a cinnamon roll. So he always makes sure that he brings a cinnamon roll to their house when they're going to engage in kink activities, and she gets her little cinnamon roll and everybody's happy. Like I said, it's different for everybody. We want to make sure we also designate time for it. So, I mean, when we're engaging in kink in general, we want to make sure it's not like, okay, let's do this in 10 minutes and then we're going to work. I mean, maybe sometimes that'll happen. That's what we have time for, but it's recommended to designate time, to have enough time for the scene, and also to have enough time for aftercare and make sure everybody's feeling good. Aftercare can also extend to later as well. So say I did my aftercare thing, I had my little cinnamon roll or whatever, and then the next time I see the person, I want to talk more about whatever kinky play we engaged in. That's still a type of aftercare. Does anyone have any thoughts on aftercare or types of aftercare that they have encountered?
I would definitely want to mention the fact that aftercare is a way to mitigate sub/top drop, definitely, but that the drop can extend for more than just the post-scene amount of time. It can go on for a couple of days or a couple of weeks, or it can so happen that some people don't really feel anything right after the scene because of all the chemicals pounding in their brains. And a couple of days later, they just get a little bit of a mood drop or a low affect overall for a couple of days. So I do think it would be important to focus on the general checking in process with all parties involved within the scene over a few days after the actual activity.
Yeah, that's really good to bring up. Thank you.
One thing I do want to mention is, especially if people are having engaging in chem sex, the come down can be really difficult for people who, use stimulants, and especially if you're using meth, right? The come down, the crash can be really difficult. So knowing and planning out what that space looks like for you in terms of comfort, hydrating, taking breaks, because sometimes we can lose orientation and sense of time and things like that.
Yeah, thank you.
Yeah, when it comes to Chem Sex, I always try to make sure that I know what everybody's comfort food is, because I know that for a fact, like sometimes you might not want to eat while you're engaging, but there's just something that, you know what I mean? Hydration, and then to your point, making sure everybody has something that they want after, just for that come down period. But more importantly for me, it's the time. I want to make sure that I have at least a day for me to just chill and relax before I can start talking with people or even looking at people anymore. So yeah, no, seriously,
Yeah.
I think it's important to know yourself and what you need to get yourself back to, I don't want to use the word normal, but functional, for lack of a better. Yeah.
Thank you. All right. Now, I know some of you are providers or work with clients in whatever capacity. So I want to talk a little bit about kink-informed care. So one thing to know is that clients often don't disclose that they engage in kink with providers. Because of this, well, it's because of stigma. They don't know how the provider is going to react. They may have had negative reactions in the past from providers or professionals. And when people don't disclose regularly, it leads providers and professionals to the perception that kink is not that common and that it's an anomaly. In reality, 40 to 60% of the US population has kinky fantasies. Now, they don't all act on them, but they still think about them. So first, I want you to know that you will hear of kinks that you had never thought of. If people are telling you they're kinks, then you may hear some stuff that feels really wild to you. But as we know from the internet, if it exists, it is a kink and somebody is into it. So first, you want to stop and think before you respond. You want to think, am I asking because I need to know or out of curiosity? Now, if the person wants to volunteer information and that satiates your curiosity, great. But if you are asking questions, are you prying, or is this helpful to assessing the person's health and well-being? It is, I mean, we talked about this, but some kinks are quite risky. And that may add to the initial feeling or reaction you have when you hear about them. But there's always ways to reduce risk. taking a non-judgmental tone while strategizing with the client ways that would be that would work for them to reduce risk is definitely the route to take. Listen to what they have to say non-judgmentally, and remember that it's okay to say, I don't know, but I'll find out. I do that all the time. I mean, nobody knows every single thing. Sometimes a question might feel like it came out of left field, and it's okay to say, let me get back to you on that. It's better to do that than to give information that may be incorrect. There is some research on kink. First of all, I want to mention that numerous studies have found that kink practitioners are just as mentally healthy, on average, as the general population. People who engage in kink aren't doing it because they have something wrong with them, or there's also no compelling evidence that kink stems from trauma or abuse any more than anything else does. So the people who engage in kink are just, you know, on average, regular people, like the rest of the population. They just happen to have this interest. And it's important to remember that rather than pathologizing kink. So I have these guidelines. It is from a paper from the University of California. This is just an excerpt from it. It's a pretty comprehensive list of guidelines for clinicians engaging with folks who are kinky. And I just picked out a few sample guidelines. So first, understand that kink is an umbrella term for a range of consensual, erotic, or intimate behaviors, fantasies, and identities. Kink fantasies, interests, behaviors, etc. don't indicate the presence of psychopathology, a mental disorder, or lack of behavioral control. We want to recognize that stigma directed at people involved in kink can negatively affect health and well-being, and that we have to understand the importance of consent and how it's managed in kink interactions and power exchange relationships. I have bookmarked the paper that this is from, and you can feel free to email me. I can send you the link to it. My email address will be at the end, but it is really good information, and I think it could be useful for folks who work with kinky folks. Okay, so somebody also had a question of kink versus abuse. Now, like I said earlier, some of the behaviors that we engage in kink can be, in other situations, would be abusive behaviors, like hitting or saying like sexually shaming words to somebody. We would not go up to somebody on the bus and say, wow, you're a slut. But in bed, if we have in advance said, hey, I would like it if you do that, if you call me a slut, then it is consensual and acceptable. And consent is the key word here. Kink needs to be consensual and informed. Consent needs to be able to be withdrawn at any time. It can't be coerced. It needs to be informed. And kink should be open to renegotiation. That is to say, if I agreed to a kink act and then later was like, I don't want to do that anymore, even if we've done it a bunch of times and I liked it, we can renegotiate what's acceptable. The example I like to give is that 50 Shades of Grey is a good example of abuse disguised as kink. In it, she signs a contract that Christian Grey can do whatever he wants without question. She can't change it. That is not how we safely engage in kink. A contract or whatever, if you do choose to sign a contract as like, I mean, some people like to do that as like part of the role play, I suppose, but that even should be able to be renegotiated. It is all about consent. I have an example of a case of abuse disguised as kink. And I had a friend who worked in a sexual assault crisis center whose client wouldn't let her call an ambulance without her first asking her like kink master's permission. That is not kink, that is abuse. If you are in an emergency situation and you cannot get the emergency help you need without asking first, That's an extenuating circumstance where your kink dynamic should not apply. Does anyone have any questions about that?
Yeah, Kim, there's actually a couple that came up, but one of the first ones I think related to that is, can you speak about consensual non-consent? And I don't know if Sarah wants to talk a little bit more and expand, but if you have ideas, that'd be great.
Yeah, definitely. So
I can
consensual.
speak
Oh,
more
I'm
if
sorry.
you like.
Yeah,
I
please
can
do.
speak more if you like. I am a mental health therapist. I had a patient in a previous relationship where this was the dynamic. It wasn't necessarily an area that I knew a lot about at the time, and that's something where I just want to hear somebody who knows more about this dynamic kind of talk more about it.
Sure, yeah. So consensual non-consent, a lot of times people abbreviate it to CNC, is where folks pre-negotiate a role-playing scenario where they reenact like a non-consensual sexual encounter, so a sexual assault or rape, but it is pre-arranged in advance. Again, there does need to be a safe word, especially in this scenario where the submissive, I guess, might say no, but that doesn't mean no because they pre-negotiated that. I have heard of folks actually using that as a way to heal from actual sexual trauma because they will use it to create a controlled scenario in which whatever events that happen to them happen again, but in a way that they can say stop and they're in control of. And some folks have found this to be useful. Other people, it doesn't necessarily mean that you have sexual trauma. Some people are just interested in it. But the difference between consensual non-consent and sexual assault is that there is the ability to stop and it is pre-negotiated what is and is not okay. Does that make sense?
Yes, thank you.
Absolutely.
This was a little bit different in that the person was living, they were living together, and this was their ongoing dynamic. And that's where, like, I don't know, would it be part of the pre-negotiation to like set in times where you would reevaluate the agreement? Like, would that be part of the negotiation that would be expected, right? Or is that?
I would definitely say there should be opportunities to renegotiate at any time. Yeah.
I can actually speak to that
Thank you.
as just generally carrying out research around trauma play, as we would call it, or just consensual non-consent as a whole, as well as kind of having seen / being in a lot of dynamics where the negotiations are very much extended towards 24/7 dynamics. A lot of the time, what is expected is either a general understanding, and that's for more experienced people in kink dynamics, but the general understanding that if something is going on or if somebody's uncomfortable, they can tell their partner / partners, hey, let's have a sit down, let's talk about our current dynamic / contract / agreement, and let's reevaluate this, and that aspect, and let's re-implement that into our 24/7 dynamic. That's definitely one thing. Or a lot of people I've seen have either a weekly or a monthly, depending on what's more comfortable for them, a certain check-in where they either put their dynamic aside or simply agree to speak without any formalities or protocol of speech that they may have pre-negotiated in the dynamics previously, and kind of touch on again, hey, are we still okay with doing this? Are we still happy with doing that? Is the consensual non-consent, or in your case, Sarah, might be some sort of free use arrangement where one person constantly 24/7 has sexual access to somebody else, might renegotiate. Does the free use dynamic still satisfies everybody involved? Is that still okay? So I would say putting time aside to renegotiate dynamics would definitely be up there on the list of important things to do.
Perfect. Thank you.
Awesome. Yeah, thank you so much for that input and for the question.
I see Sarah's hand.
So as a working in a rural sexual assault program, a lot of my clients either enjoyed CNC before their assault and are trying to figure out like how they're going to ever do that again without it being too triggering, or like you said, Kim, they use it to kind of like reclaim the power from the power that was taken from them. What I usually tell them is, you know, I don't give a lot of advice. It's very survivor led, but I'm like, all right, first, let's do a pros and cons. Let's safety plan before you talk to your partner about this. And then let's talk about self-care as aftercare, not just, you know, caring for your partner and checking in, but also a lot of self-care, because if it does trigger something for you, do you have our crisis line number? Can you get a hold of me as your advocate or another advocate? Do you, you know, what are you going to do so that if this doesn't go well, you have, you know, an ability to check in so that you don't, you know, potentially self-harm or do something that is going to, you don't involve a harmful coping mechanism and then, you know, kind of like impact that trauma on, you know, continue impacting that trauma. So CNC is a big one for a lot of my clients, but again, we look at it like, okay, this can be great if and it can be empowering, but let's figure out how we're going to take care of ourselves while we're doing that.
Yeah, thank you so much. And that actually just reminded me another thing in the case of trauma, like you said, or just in general, is to start small. So instead of just jumping right into a whole negotiated CNC scene, maybe have your partner initiate sex without asking at a pre-negotiated time and in a pre-negotiated way, and see how you feel about that. And then if that feels good, then maybe see how it would feel if you negotiate a safe word and then you said no and had your no ignored as a pre-negotiated thing. And if that feels good, maybe add something else on, because that way you can just kind of digest it in little bits to build up on something that works for you.
Another way to do that as well, I would say a lot of the time trauma happens not necessarily in one big, huge, life-changing event. It can happen in a lot of tiny little bite-sized things, or it can simply involve a sexual encounter where a person said, okay, I'm okay with this, this, and that, and not just for example's sake, and not with kissing. And trauma like CNC/free use scene that is used to process trauma in that case could involve a fully consensual, like again, just actively, visibly consensual, aka not CNC sort of arrangement, while incorporating the one tiny event that has a correlation to the trauma. So, for example, kissing in a specific way or for an extended period of time that is reminiscent of the original trauma, while keeping the general level of physical pleasure and enjoyment in a heightened state, which does, according to what I've seen, kind of add to the correlation of, oh, pleasure, I'm safe, this is a pleasurable experience, while I'm re-experiencing, recontextualizing something that happened to me at a traumatic time. And that's kind of another angle one can take to not necessarily embrace, but reprocess that traumatic experience mentally while enjoying a kink scene.
That's really
Absolutely.
great. Thank
It's
you.
completely multifaceted. It's
Mhm.
not one or the other.
Yeah, everyone's different. Leo has his hand raised.
Hi, I have a separate but sort of related question, which is curious about the kind of blurry line between self-harm and enjoying masochism, because I do both. And I just have you heard of ways that people navigate that kind of blurry relationship?
That's actually not something that I have a ton of knowledge about. Does anyone else have a response?
I can speak to that if
Thank
that's
you.
all right.
Yeah.
Yeah. So currently a lot of the research that is done on that topic is still in the process of being coded, added onto the paper, added to the manuscripts. It's not as common. It's definitely something that's slowly building up, but it's not that common. There have been accounts of people saying this is something I have done in a context of self-harm, and I do something similar in another different context where it's very kink adjacent and it's very freeing and it's very cathartic for me. And a lot of time that would involve some types of blood play, that would involve impact play. And I'm going to use the impact play as an example just to avoid any potential triggers, generally speaking. But there are some people that tend to hit themselves when they were overwhelmed or when they were having a certain meltdown or when they're having flashbacks. And within a control kink scene, they had their dominant slash top instruct themselves to hit themselves in a very specific way and stop at a command and keep going again to really have them understand how it can feel like to have control over those urges, to have control over that urge to hit themselves over and over, for example. And that leads to the practice of that impact being more harm reduction oriented rather than as a whole self-harm sort of activity that they indulge in, which later on in turn led to a much more different association with that urge to hit themselves when they were overwhelmed or, yep, my bad, I'll slow down, when they were overwhelmed or having a flashback. And let me find my thought again, one second. Yeah, so when they were having a specific trauma flashback and started having the urge to hit their head or hit their arm, they kind of had the tools and the ability and the past experience to be able to go like, oh, I've stopped myself before when I've had that urge when somebody told me, hey, stop that. And they were able to add in those coping skills in their day-to-day life when they were triggered by something outside of a kink scene. So there's definitely a potential distinction there that can be made, and it can even be used to mitigate certain risks on a more day-to-day baseline.
Thanks.
Thank you. That was
That's really
helpful.
interesting.
No worries. I don't want to take too much time, but yeah.
No, that was really interesting. Thank you. I do want to quick get to resources, just to make sure people have, further reading and stuff. Some of the ones that I've really liked, Ultimate Guide to Kink by Tristan Taormino is a pretty good intro. For those of you who live in Connecticut, Upline Studio in New Britain, people come from fairly far away to go there. It's pretty good. Tashra.org. I know, Aiden, it says you're from Tashra, so cool. I like the book Tell Me What You Want by Justin Lemiller. It talks about communicating with your partner about your boundaries, what you're interested in, trying new things. And then chemsexharmreduction.org. That's actually Yona's site. Big fangirl over here for Yona. And yeah, so I see a raised hand from Kira.
Hi, I had a specific question about talking about kink from the perspective of a health educator. I specifically work with youth. And a lot of what I do is like queer sex ed and then like harm reduction education for youth. And something that has not previously been done before at my current organization, but I'm really hoping to bring into our curriculum is having kink be a part of our sex education and also our harm reduction curriculum. So I was wondering if there were any like resources that you could share, or even if you were if anybody knows of like times where you could be available to talk one-on-one about specifically how to come at this from like an educational standpoint for our young people.
So one thing I want to mention first is it is so difficult to get kink into youth curriculums because it is very politically unpopular. So I'm sure you know this, but it's hard enough to get sex ed to youth, but oh my God, what a nightmare. Even in Connecticut where people are like, oh, it's so blue and everyone's liberal, like, not about that. But one resource I actually really want to recommend for youth sex ed in general, but they are kink inclusive, is the Youth Sexpert program. I'm actually on their advisory board, and they basically do online cohorts where they teach youth how to become peer sex educators. And
cool.
Yeah, Tara, the person who runs it, is wonderful. And knows a lot and is great with kids. So highly recommend connecting with them.
That was Youth Sex
Youth Sexpert program.
Youth Sexpert program.
Just
Okay,
put it in the
awesome.
chat, Kira, so you're all set.
Okay, thank you.
Oh, Kim, we got a request. Can you go back one slide to your resource?
Yes. Oh, of course. Yeah, sorry.
No, no problem.
Any other questions?
Oh, we actually just had one come in from Christina. Christina says, I have a question. Sometimes after a really intense kink scene between my partner and I will become emotional and cry. I'm not hurt or scared or regret anything that was just done. In fact, I love it, and it was all discussed and consented to beforehand. I just get very emotional and have a little cry afterwards.
Oh, that is so normal. Oh my gosh. Having feelings will make you cry. If it's positive feelings, if it's angry feelings, if it's sad feelings, if you're just feeling a lot of feelings, some people just cry. And I'm actually a huge crier. Like when anytime I'm below a 4 or above a 6, I'm crying. And I just tell people, don't worry about it. It's just something that's happening to my face right now. And it is difficult to I mean, socially, we're conditioned to think that crying is like weak or a problem that needs to be taken care of. And it's so hard to uninternalize that feeling. But I just want to make sure you know that it is very normal and okay.
Also, let's keep in mind that all of your little brain chemicals are just giving a big crash at the end of that scene. Like you're really up there in your feelings, feeling all the endorphins, feeling all the pleasure. And the crash doesn't necessarily means you're going under your baseline of feeling. You're not ending up necessarily feeling sad or feeling angry, but it's still a big drop from a very big high to your normal baseline. And it's very normal for that to feel like a huge cathartic experience, and the tears are going to come naturally from that emotional release.
I also want to make sure that my contact info is up there. If anybody has questions for me, I also do have an Instagram for folks who are local. I do a lot of sex ed events all around Connecticut, and I do also do some virtual ones. On Sunday, I'm actually doing one on sex ed for caregivers for folks who work with or take care of children of all ages. So that's fun. But yeah, if you have questions that you think of later, please definitely DM or email me. And I think we have, we're about to be out of time. Taylor, you needed to go over a couple of things, right? Like plug Yona's thing.
Yeah, just a few housekeeping things. Just want to let people know what we have coming up. So on May 2nd, it's our new date. We had to reschedule this session, but we have Yona Tangi, who's a wonderful provider. They actually were working at Whitman Walker down in DC. They've taken a position, I think, just in the last few weeks, full time at Amita Care. But they're a wonderful provider. I've known them for many years. Kim knows them as well. They're coming back to do more of an advanced Chem Sex session for us. They've done our Chem Sex 101 trainings for Lighthouse the last couple years. So stay tuned for that one. We have our feedback form, a certificate request form as well. So if you're looking for something that just says that you sat through this session, you need a certain number of hours, we can certainly provide that. My only request is that folks please make sure that if you are attending more than one session, just wait until you've attended all them so I don't have to make like 50,000 certificates. The other thing is, and I appreciate folks pointing this out, and Kim knows this too, we're here providing information to talk openly, right? Nothing we share is meant as encouraging you to take certain risks with your body to jeopardize your own health and safety, right? So folks are ultimately responsible for their own choices and behaviors. We're not endorsing any particular action, right? We're just making space for informed conversation. Just throwing the disclaimer out, which I do appreciate. And I think most of our folks know. But because the work that we do is highly criminalized, right? Talking about our bodies, talking about trans bodies, sex, drug use, right? Just making that abundantly clear. But I just so appreciate everybody joining, engaging so thoroughly. So we're gonna wrap it up here. But Kim, if you want to say any last words. It's all
Thank you all so much for coming. And also, I love when I do these things and learn from other people too. So thank you so much for all your input as well.